Okay, great. So here's what we're going to do here, or I'm going to do here today. The first thing is just to look at what is the conception of psychiatric disorders that our society has organized its thinking around for the past 43 years. It's often called a medical model, but in fact, it's a disease model. Hold on, I just need to change one thing. Okay. It really is a disease model. So we'll look at what were the origins of that disease model, whether it was founded in science or whether there was basically guild interests. By guild, I mean the American Psychiatric Association behind this adoption of a disease model. Then we're going to look at, secondly, we'll look at how the pharmaceutical industry was so pleased with this disease model because they knew that it would expand the market for psychiatric drugs, and how there was a merger of interest between the Guild, American Psychiatric Association, and pharmaceutical companies. And we'll look at how that affected the story that was told to us. The next, we'll look at real briefly the public health outcomes with this form of care. And then we'll spend a bit more time looking at the long-term outcomes for people diagnosed with psychotic disorders and treated with antipsychotics, and then also diagnosed with depression and treated with antidepressants, because that part of the story will tell us whether this model, which emphasizes drug treatment as a first-line therapy, what is the evidence base for it? How does it affect people long-term? And then finally, after we've been through that, we'll really see at this point that this disease model has failed from every sort of point of view. And that opens up the question, which is being raised by many people today: what type of model of care could replace this disease model that we've had for the last 43 years? Okay, so now I have a problem with my thing. Why is it not working? There we go. So this was what I was just talking about, what we're going to talk about, how this talk's going to be organized. We're going to look at the DSM-3, what was the birth of it. Then we're going to look at the merging of guild interests and pharmaceutical interests. And then we're going to see how that merger of interests corrupted the narrative that was told to the public. And in fact, how it was out of sync, that narrative, with what actually the research was showing. So DSM-3, that's the Diagnostic and Statistical Manual published by the American Psychiatric Association. They published their third edition in 1980, and that's when they adopted what they called the medical model. But as we'll see, it's really a disease model. And here's a quote by Jeffrey Lieberman, who was the former president of the American Psychiatric Association. He said, DSM-3 was the book that changed everything. And he's correct about that. This changed our conception of what we see as normal, what we see as abnormal. It changed our conception of sort of our philosophy of being, how we respond to the world. We began seeing ourselves as almost under the influence of our neurotransmitters, as if they directed ourselves. And it's going to change how we raise our children as well. So when he wrote this, Jeffrey Lieberman, he wasn't just talking about a book related to change things in psychiatry. It actually changed everything in our society. And at another time, he said it's the most important book that's been written in the past 50 years. And I agree with him in terms of the influence it had on our society, because it did change us as how we think about ourselves, how we think about children, and how we organize our thinking about what to do when we're struggling. So if we go back to the origins of DSM-3, it's going to be presented to us as a scientific advance, but that's actually not what history shows. What history shows is that in the 1970s, psychiatry felt as a profession that it was under siege, and that there was a lack of respect for psychiatrists as being real doctors. And what was the criticism? Well, there was an anti-psychiatry movement that was rooted in actually the academia, in academic settings, that said psychiatry doesn't really function as a medical discipline, it more as a mechanism of social control. That was one problem. A second problem is talk therapy was sort of its bread and butter for people outside the asylum in the 1960s and 1970s. But they were increasingly the preferred form of talk therapy in psychiatry was Freudian-based psychoanalysis. But they couldn't show that their form of talk therapy was any better than the talk therapy offered by psychologists, counselors, and so many others who were setting up shop as therapists. Now, benzos arrive in the 1960s. This is Valium and Librium, mother's little helper. These become the first real popular psychiatric drugs. But by the 1970s, benzodiazepines were being recognized at a government level of being addictive, that they shouldn't be used long term, and that they were causing all sorts of harm. And you had newspaper magazines talking about when these drugs turned on you. We had a psychiatric survivor movement rising up, and this was formed by ex-patients of hospitals who said they wanted to be free of psychiatry. They had survived psychiatry, and now they wanted to be free of psychiatry and its drugs. Then there was a famous study by David Rosenhan, a psychologist, in which he sent himself and 8 of his students into mental hospitals, and as they arrived at the front door, they complained of hearing a word like thud, and they were all admitted. They were diagnosed with schizophrenia, and they were never seen as imposters by the staff of those mental hospitals. And then finally, there was a very famous movie, One Flew Over the Cuckoo's Nest in 1975, which depicted the mental hospital as basically a place of abuse. And actually, maybe the staff were crazier than the patients. And all this produced a crisis. Now, there was a scientific impulse because the diagnoses in DSM-2 were understood to lack validity and reliability. They weren't really very useful. And researchers at Washington University said, we need to start over with our diagnoses, and maybe we can get 20 general categories, and we'll start researching them to see if they're valid categories, valid diagnoses. But that scientific impulse was abandoned based on the guild impulse, the guild need to rebrand psychiatry. And they said to themselves, how are we going to distinguish ourselves from psychologists? How are we going to distinguish ourselves from other counselors? And they said, we need to present ourselves as doctors in white coats, because the white coat, of course, has great prestige in our society. So they said, we need to adopt a medical model and present ourselves as a medical specialty that treated diseases of the brain. Okay, they're going to do this to rebrand themselves. And you'll see Gerald Clerman in 1978, as this is being done, this development of DSM-3 is being done. They said, there is a boundary between the normal and the sick. It is the task of scientific psychiatry as a medical specialty to investigate the causes, diagnoses, and treatment of these mental illnesses. So they're saying these are illnesses of the brain, they're diseases of the brain, but the important thing to recognize here is these were actually hypotheses. There was no science actually identifying them as diseases of the brain, but they adopted this model to rebrand themselves to the American public. And then there was a famous book called The Broken Brain, written by Nancy Andreasen, who was editor-in-chief of the American Journal of Psychiatry. And she presented this new model to the public. And she said, the major psychiatric illnesses are diseases. They should be considered medical illnesses, just as diabetes, heart disease, and cancer are. And now watch this. The thought is that each different illness has a different specific cause. There are many hints that mental illness is due to chemical imbalances in the brain, and that treatment involves correcting these chemical imbalances. Now, this is the story we're going to hear. We're going to hear that researchers have discovered that depression is due to too little serotonin, and schizophrenia and psychotic disorders are due to too much dopamine, and that we have drugs that fix those chemical imbalances, like insulin for diabetes. Now, that's a story, if true, would represent, in my opinion, the greatest medical advance in history, that they had discovered the very molecule that caused madness, or the very molecule that caused depression, and they could fix it. And when I say it would be the greatest advance in medical history, it's because the brain is so incredibly complex. And that's the story we're going to be told. Now, just real quickly, when this disease model was adopted, when it was presented in 1980, the pharmaceutical companies thought this was the greatest thing ever, because what they understood now is so many sort of ordinary problems we have, ordinary problems of living, the unhappiness that sometimes we feel, the worry that we feel, the setbacks we have in life. which we before understood were problems in living, are now going to be classified as diseases. And once they're classified as diseases, pharmaceutical companies can get FDA approval for treating that disease. So, for example, you can't get a pill for treating unhappiness, but you can get a pill for treating the disease of depression. So they're going to be thrilled with this. Now, once they come up with this new model, the American Psychiatric Association says we now have to sell this new model to the public, and they set up all sorts of public relations machinery to sell this story to the public. They set up a new division of publications and marketing. They courted the media, holding media days, telling of great advances in psychiatry. They ran media training programs for psychiatrists around the country, what to say to the press in order to sell this story. They developed fact sheets that were distributed to the press that told of advances in research, how the psychiatric disorders were diseases, and that drugs were safe and effective treatments. And then as new drugs came to market, they partnered with the industry to tell of new diseases and effective new drugs. And just so you can see this, once in 1980, once the American Psychiatric Association adopted this disease model, the pharmaceutical industry is going to start flooding them with money, the APA, to do this PR, to sell this new story to the public. And you'll see in 1980, they gave about $10 million to the American Psychiatric Association to fund its various operations. But then you see a steady increase, and especially an increase when new drugs come to market, like the SSRI antidepressants in 1988, atypical antipsychotics. So they went from 10 million in 1980 to roughly 70 million in 2008. Now, what happened in 2008, Senator Charles Grassley, published information about how much money was being given to individual psychiatrists to promote this new story. And the APA, to sort of save face, had to phase out symposiums, at least for a period of time, at their annual conference that were paid for by drug companies. And that's why you see this drop in revenues. And here are just what I've already talked about. Basically, the pharmaceutical companies were giving this funding to the American Psychiatric Association to sell this new story to the public and to the medical community. And one of the big things were these, quote, scientific symposiums at the APA's annual meeting. You'd go there, and everybody could go to a breakfast or a lunch or a dinner, a free meal. And at the meal, there would be talks by very well-known psychiatrists talking about disease models, about new drugs, the effectiveness of them. And it was seemingly a scientific presentation, but in fact, those presentations were vetted by the pharmaceutical companies who were paying the doctors, the psychiatrists, to give that story. Okay. Now, just to give you an example, so money, we looked at just a second ago about money that was flowing to the American Psychiatric Association. Money was also flowing to individual psychiatrists, prominent psychiatrists at academic medical schools, to be their thought leaders, their key opinion leaders. So they began paying people to put their names on clinical trials, to serve as advisors, consultants, give continuing medical education classes, to give presentations at the APA's annual meeting. And here's an example of what Charles Grassley reported in 2008 of just 4 people who had helped build markets for different drugs. Joseph Biederman was very big in building the market for ADHD drug. He got 1.6, and by juvenile bipolar, he got 1.6 million from one doctor alone. Frederick Goodwin was a former director of the NIMH. He got 1.2 million to help promote a drug for bipolar disorder. The bottom 2 are psychiatrists, child psychiatrists, who help build markets for prescribing drugs for ADHD and juvenile bipolar disorder, and antidepressants, actually. So for building markets for prescribing drugs to children. And this is what I'm just saying. These thought leaders, they're the ones that we as the public rely on. So what do? They serve on task forces that establish the diagnostic boundaries. They conduct clinical trials. Actually, they put their names on reports of clinical trials. The clinical trials are analyzed and summarized by the drug companies themselves. Then they would, put their names on those articles. They would, when the media called, the media would call them to understand the efficacy of new drugs. And they would be the people who would speak about the validity of the new disorders, efficacy of treatments at scientific symposiums, continuing medical education courses, other professional forums. They set the clinical practice guidelines. They write the textbooks, etc. So thought leaders who are being paid by drug companies are going to be the people that sell this new story to the public and tell us that these are real diseases and the drugs are safe and effective. And we're going to be hearing about the chemical imbalance story as well. Now, in 2008, I attended the annual meeting of the American Psychiatric Association, and they had in their guidebook a list of the speakers who had to say how many consulting agreements they had with pharmaceutical companies. And you'll see that 373 speakers disclosed they had 888 consulting agreements with pharmaceutical companies. And 483 were serving on the speakers bureaus, meaning they would go out around the country and help them sell their drugs. So what you see here is basically a capture of academic psychiatry by the pharmaceutical industry. And here's what psychiatrist Daniel Carlott said in 2007. Our field as a whole is progressively being purchased lock, stock, and barrel by the drug companies. This includes the diagnoses, the treatment guidelines, and the national meetings. Now, we in the public think we're listening to, academic scientists as they're telling this story about the disease model. We really didn't understand for so many years that they were working for the drug companies to promote this model. And I did a look at the industry payments to psychiatrists more recently. And here's what I found in 2016, 2017. There's something called the Open Payments Database where you can find this data now. Over half of all active psychiatrists received some payments from pharmaceutical companies in these 2 years or something of value. Total payments during the 2 years of $110 million from industry to 26,000 psychiatrists. 71% was for speaking and consulting fees. These are the people that form public opinion. And the leading guy is someone named Stephen Stahl. He runs a continuing medical education company, and he got more than $3 million during these 2 years. So what we just saw is that following the publication of DSM-3, pharmaceutical companies, well, number one, the APA itself wanted to sell this story, this disease model to the public. And number two is the drug companies were so happy about this, they understood it was going to increase the market, and they began giving money to the APA to tell this story, to fund its public relations efforts. And they began giving money to academic psychiatrists to serve as their speakers and key opinion leaders. And by the way, in the late 1990s, the New England Journal of Medicine wanted to do a review about the efficacy of antidepressants. And so they looked for experts in mood disorders in the United States at academic centers, and they basically almost couldn't find anybody who wasn't taking money from the pharmaceutical companies. So by the end of the 1990s, basically this capture of academic psychiatry by the pharmaceutical industry was complete. So now we're going to move to the next question. Did this merger of interest, did this financial influence of both guild interests and pharmaceutical interests, did it affect the narrative science that governs psychiatric care? In other words, what were we told? How did it affect the setting of diagnostic boundaries? And how did it affect reporting results from the trials of psychiatric drugs? And what we want to see as we do this is, was the story told to us consistent with what actually is in the research? Or is there a big gap? Okay.